There's always somewhere to go. A statement never more true than when it comes to sports, where athletes are often in nearly constant motion, and the most common form of transportation for athletes are their lower extremities. Here are the orthopedic and sports medicine experts of Trinity Health System to remind us that to every on-the-go champion, health matters.
So lower extremities are everything from the hip joint down. So the hip joint, thigh, knee joint, leg, and the foot and ankle. We normally think about our heart, our liver, our lungs, but we don't really pay attention to a healthy lower extremity as such. And if you have to just think about how to keep them healthy, it basically boils down to three important things. One is all the joints in the lower extremity need to have a good range of motion. So your hip joint, knee joint, and foot and ankle needs to have a good range of motion. For that, you need to stay active and move these joints around. The second thing is flexibility. And some of that depends on how well the joints move. Some of that depends on how tight the muscles are. And to make sure that the joints move, you need to have these muscles that are supple and elastic the way we were born, all of us. And as we start working, sitting in classrooms, maybe sitting at desks, sitting in front of a computer, we end up having stiff muscles, and we need to do a few specific exercises to make sure these muscles are supple and flexible. And the last thing, but not the least important, is the strength. Strength is important because at some point you're going to fatigue if your muscles are not strong. And to develop strength, what you want to do is do some activities that involve resistance training. It not only builds the strength of the muscles, it also helps to build the strength of the bones. If you're not doing resistance training, you're essentially having a chance that the bones will get weaker and create what we call as osteopenia in the later stages of life. So you want to do some resistance training to keep these bones strong as well. If you think about the lower extremities, what we need really to do to focus on them being good is having good range of motion, good flexibility, and good strength in the joints, and good endurance in the muscles. And by that I mean regular exercises and good nutrition. Any pain that lasts more than 20 minutes after exercising is not healthy pain. So the first thing that should warn you about something not being right is pain longer than 20 minutes. Now, in certain situations, if it's been a long hike, let's say you've gone on a hike and you've hiked for 3 hours, it's okay to feel the soreness overnight or the next day. That's fine. But if you have severe pain, if you have burning pain, either in the hip joint, the knee joint, in some portion of the leg or the thigh, or even at a specific point in the foot, then that is not normal pain. The other important thing is swelling. Some people may have associated medical conditions like high blood pressure, diabetes, some kind of vascular problem. In those people, it's okay because they know that there could be some swelling in the legs that comes with the condition. But if you do not have any other medical conditions, if your joint is swelling with no obvious reason, or if your leg tends to stay swollen at the end of the day and it goes down only after you've laid down for the entire night, only to come back again the next day, that's also not a good sign. The third important thing is none of the joints are supposed to be lax. And by lax, I mean extremely loose. So if you're trying to walk around or run around and either your hip joint gives out or your ankle gives out, you feel like you're not confident when you're walking and it's going to just twist or it's going to buckle under pressure, that's not a good sign either. So instability is something that needs to be not taken lightly, and that is something which is not a sign of a healthy lower extremity. And the fourth thing that's also important is very easy fatigability. So you take a few steps and you have to stop. You take a few, you do a little bit of a walk and you feel like the lower extremities are going numb. Anything like that which causes some sensory abnormality, a feeling of tingling numbness, or a sensation that the legs are getting heavier with a few steps, you need to stop and think, because this may not be just the lower extremities, but it could be coming from the lower back. The problems that commonly we see with lower extremities are either some kind of pain in the joint, some chronic vague muscle ache or fatigue, giving out of different joints in which you feel unstable, not confident when you're walking, or recurrent swelling, which causes a lot of discomfort to people with a lot of swelling in the legs. Acute injuries involve injuries to the bone, some like fractures, and that's very obvious because the patient cannot or the person cannot walk after that. Injuries to the joint, which can either be acute or chronic. By acute joint injury, it could either be that the joint just gives out. For example, the kneecap dislocates and comes back. If you're playing football, you get kicked in the joint, the MCL sprains. All these sprains, even though they're ligament injuries, they affect the joints, and the cartilage associated with the joint also gets affected as a result of that. So acute injuries will either involve some kind of a trauma or some kind of a twisting or turning injury. On the other hand, chronic injuries or long-term repetitive injuries will involve injuries to the muscle, where the muscle can have a tear, injuries to the tendon, which over time the tendon starts to deteriorate and have either internal tearing or a complete tearing that can happen over time just to present on one day as a snap. But the tendon has been tearing over a long time essentially. And chronic injuries also involve stress fractures. So if you repeatedly beat up on the foot or your tibia or your leg, it can eventually cause what we call as a stress fracture, where the bone doesn't completely break, but it has partial break in it, making it very difficult for the person to even walk.
In this case, thanks to our lower extremities, we've gotten where we are, but we have a lot further to go. The orthopedic and sports medicine experts of Trinity Health System will be back next week with more of Health Matters. So stay tuned, stay mobile, and stay on the field.